So today we are going to discuss about, please, I want silence. If you want to ask something regarding the topic, if you want to discuss something about the institute, then please talk to me, not with your colleagues. Because your colleagues are as new as you in the institute. So, what do you mean by the universal precaution? कभी नाम सुना है? See, now you have entered into your medical fraternity. What is more important for you? To protect yourself, to protect your patient, to save the environment. Because whatever the infection you will be carrying in the institute, in the ward, you will be taking that infection to back to your places, back to the environment, right? So healthcare workers are more prone to infection. COVID-19 के टाइम पर क्या हुआ था? घर पे थे, okay? Expected था, but हम लोग घर पे नहीं थे. We were working, and I'm sure after 2-3 years you all will be working like the way we did. Emergency services कभी बंद नहीं होती. Medical fraternity के लिए कोई COVID-19 नहीं था, कोई और emergency नहीं होती. You all have to work like anything. So universal precautions बना ही गए थे for the healthcare workers. So it's just a brief introduction. So what are the objectives for today's session is to understand and become familiar with the universal precautions, learn the importance of good hygiene and hand washing, learn the steps of hand washing, learn the proper technique of wearing and removing the personal protective equipment. Universal precautions refers to the practice of avoiding contact with the patient's body fluids by means of wearing the non-porous articles such as medical gloves, goggles, and the face shield. They are control guidelines designed to protect health workers from the exposure to the disease spread by blood and the body fluids. Whatever the things you come in contact while treating a patient, considered all those things to be infectious for you. You never know unless the reports of the patient come. Suppose a patient gets admitted in your ward and says that that person is suffering from high-grade fever from the last 4 to 5 days with a history of loss of weight. What you are going to expect? It can be anything, right? Cold cough की history दे रहा है, तो क्या हो सकता है? TB हो सकता है. Then what is your importance? To protect yourself, to protect the patient. So what at that time what you are going to keep in your mind? The universal precaution. Why we need it? How we are going to handle the things? And what precautions we are going to take? Why universal precautions are required? The concept of universal precautions emphasizes that all our patients should be treated as though they have potential blood-borne infections and can affect the healthcare workers. Precautions means to reduce the risk of transmission of blood-borne and other pathogens from the both recognized and unrecognized sources. What is the meaning of recognized and unrecognized sources? One thing is you are aware that the patient is infected with some disease. Like if you know that the patient is having the history of TB, so you know you infected hai. Another is you don't know anything about the patient, the first exposure of your patient. So consider all those patients as infected. So what are the different modes of transmission? It can be through contact, through droplet infection, through airborne, or other source of infections like through contaminated water, contaminated food. The contact can be direct or indirect. Can someone explain me the meaning of direct and indirect contact? What are the components of universal precaution? These are the main key elements of the universal precaution. Hand hygiene, personal protection by PPE. You must be knowing the full form of PPE, right? COVID के टाइम पे ही पता चला होगा. Preventing injuries from the shaft, cleaning and disinfection, respiratory hygiene, safe injection practices, and biomedical waste management. Although I'm not going to cover biomedical waste management today, it will be in your next class. Hand hygiene. Hand hygiene is considered a primary measure for reducing the risk of transmitting the infection among patients and healthcare personnel. It can be performed by using the warm water, soap, antiseptic solution, or any kind of a hand sanitizer. When to perform hand hygiene? Immediately when you arrive for your work, before coming in direct contact with the patient, putting on gloves for the clinical or any kind of invasive or non-invasive procedures, for giving any medication, for the preparation of the medication, for feeding a patient, and at time of leaving your work. Between the procedures on the same patient. Supposedly you are working for a same patient, then you have to change your gloves. You are putting a catheter to a patient and then you are injecting some medicines, then you have to change the gloves. After coming in contact with the patient, removal of gloves, removal of other personal protective equipment, coming in contact with the blood, body fluids, secretions, excretions, wound exudates, contaminated items and surfaces. Personal body functions such as using toilet, wiping or blowing one's nose. These are the conditions when you have to use your hand hygiene properly. What are the different steps of hand hygiene? Can anyone tell me? Or how many steps of hand washing are there? 12. Okay. How many of you are saying 5? So, hand hygiene, we all know. Hand hygiene is very important. But during COVID, it became a practice for all of us, right? हम घर में भी सबको कहते रहते थे कि ऐसे हैंड वॉश कर. उससे पहले तो नहीं था हैंड वॉशिंग के बारे में इतना ज़्यादा अवेयरनेस. What does it indicate? It indicates that hands are the most common source of spreading the infection, right? These are the 5 movements for the hand hygiene which I have discussed you, like before touching the patient, before doing any antiseptic procedures. These are the guidelines from the WHO. After touching the patient or after the body fluid exposure and after touching the patient, even the surroundings of the patient. These are the 7 steps of hand hygiene. I want anyone to come in the front and explain these steps. Can anyone? Yeah, I want someone to demonstrate. Anyone of you have done hand washing like this before? No? Now start doing like this. It's mandatory for all the healthcare workers to wash your hands like this. Learn it. Do it. Rub your palms together. Come on, you. Do it. Rub your palms together. Rub the back of both the hands like this. Okay? Interlace fingers and rub hands together like this. Okay? Now, interlock the fingers. इस तरह से. Then, clean your thumbs in rotating manners. Then rub the fingertips on the palm of your hand. And then, wrist. Clear? So, are you going to start like this today? I know, no one is going to do it. You can take the pick if you people want to, but start doing the practice. Start doing good practices because it will help you while you're visiting to the ward. So, what is PPE? This is personal protective equipment which we used during COVID. Even they are used in common way in the ICU and the OT unit. PPE includes items such as gloves, masks, face shields, gowns, and eyewear to create barriers that protect skin, clothing, mucous membrane, and respiratory tract from the infectious agent. Wear gloves while touching blood, body fluids, non-intact skin, mucous membranes, and contaminated items. Gloves must always be worn during activities involving the vascular access such as performing the phlebotomy. What is phlebotomy? Collecting the blood sample from a patient is called as phlebotomy. What are the types of PPE we use in the setting? Gloves to protect our hands, gowns and the aprons to protect our skin and the clothing, the mask to protect our mouth and the nose, goggles to protect our eyes, and face shield to protect face, mouth, nose, and eyes. Wear a surgical mask, goggles, or face shield if there is a reasonable chance that a splash or spray of blood or body fluids may occur to the eyes, mouth, or nose. Wear a gown if skin or clothing is likely to be exposed to blood or body fluids. Remove PP immediately after use and wash your hands. If PP or other disposable items are saturated with blood or body fluids, then discard into biohazard bags. How many of you got infected with COVID? Lots of. What we faced during that? Lots and lots of guidelines from ICMR, from different hospitals, lots of daily. ऐसे sanitization करो, ऐसे mask पहनो, ऐसे mask को discard करो, right? But ideally, mask कब discard करें? Depending upon whether you are using the N95 mask in your healthcare system or you are using mask at your home. Supposedly, we were working here, we were using N95 and we were daily discarding because we can't carry that N95 to our home because it's already used. These are the steps to wear the PPE and to remove out the PPE, and it's very fast. Needle stick injury. A penetrating stab wound from a needle or any other sharp object that results in exposure of blood and other body fluids is called as NSI, that is needle stick injury. Safe handling of needles and other sharp devices are the components of standard precautions that are implemented to prevent healthcare workers' exposure to the bloodborne pathogen. Used needles should be discarded immediately after use and never to be recapped, bent, cut, or removed from the syringe or the tube holder. Any used needles, lancets, or other contaminated sharps should be placed in a leak-proof container according to the biomedical waste guidelines. So, it's very important for all of you to know about the NSI, because if you are going to a ward or if you are going to a laboratory, even if you are coming to our blood center and you get needle stick injury, so what you are going to do? We have a committee in our institute for the NSI. Immediately what you are going to do, just wash the injury with the soap and the running water. Immediately. For non-intact skin exposure, wash with the soap and water. For mucosal exposure, wash thoroughly. Then you have to report about that injury. If you are getting that injury even in your any practical class, supposedly you are doing some practical in the physiology lab for the blood grouping or for the hemoglobin estimation, you will be using the lancets with you, right? Everyone will be having their own lancet. Don't reuse the lancet. If you want to prick yourself again, then again use the new lancet. Don't repeat the lancet. If you get deep prick from the lancet, then what you are going to do? Just inform the in charge of your class immediately. Wash your hands thoroughly with the water and inform the in charge of the class. What they are going to do is they are going to report the things to the medical officer of the hospital. They are going to fill the form about the NSI and they are going to take your complete history about the vaccination. If you are getting injury, if you are getting the prick with your own lancet, then you are not getting exposed to any other person. But what happens in the ward is there are the chances of getting injury to the patient also. आप उसको sample prick कर रहे थे, prick करते करते आपको भी चोट लग गया. It happens. Many a times it happens. In that case, it's very mandatory. कुछ भी नहीं छुपाना है. Just immediately inform the in charges of that respected unit, whosoever is posted with you there. ठीक है? Then the management will be done according to the depth of the injury and depending upon the cause and the agent of the injury. If you got injury with the patient, then but obviously patient के भी सारी reports करवाई जाती है about the HIV, HPSAG, सारा status patient का लिखा था. ठीक है? Any doubt about this? Because this is very important for you all. Any doubt? What is disinfection and sterilization? These are the very important and the very vague terms. Many people think that the disinfection and the sterilization and the cleaning, they all are same. Although the purpose is same, but they are different. Cleaning is the removal of foreign materials from the objects and is normally accomplished using water with detergents or enzymatic products. Thorough cleaning is required before high-level disinfection and sterilization because inorganic and organic materials that remain on the surface of the instrument interfere with the effectiveness of these processes. Means, what we do in our house, we do cleaning, right? Superficially, चीजों की हम सफाई करते हैं. But are we able to remove the microorganisms completely? No. So, cleaning is just kind of a superficial removal of the foreign material. Sterilization is a process by which an article, surface or medium is freed of all viable organisms, whether in vegetative state or spore state. Disinfection is a process of destruction of pathogenic organisms by direct exposure to chemical or physical agents called as disinfectant. Sterilization or disinfectant हम कहाँ use करते हैं? Mainly in hospital setting. ठीक है? Autoclave किया जाता है. You know about autoclaving? Okay. OT में whatever the instruments OT people are using, the ICU people are using, they do the autoclave even of the PPE also. So that is autoclave is sterilization or disinfection. That is sterilization. The difference between the disinfection and sterilization. Disinfection eliminates nearly all recognized pathogenic organisms, but not necessarily all microbial forms, for example, bacterial spores on inanimate objects. Disinfection is used to decontaminate the items. The primary objective of decontamination is to reduce the level of microbial contamination so that infection transmission is eliminated. Decontamination renders an area, device, item or material safe to handle. That means disinfection basically reduces the risk of spread of the transmission. Whereas sterilization is a procedure that kills all microorganisms, including high number of bacterial endospores. Sterilization can be accomplished by heat, ethylene oxide gas, hydrogen peroxide gas, plasma, ozone, and radiation. What are the different methods of sterilization? You are going to study in depth in microbiology about the sterilization and the disinfection. Different methods of sterilization are physical methods and the chemical methods. Physical include heat, radiation and the filtration. Heat can be dry or moist. Radiation are UV light or irradiation. And chemical methods include, what are the most common chemical methods for the sterilization? Alcohol or hydrogen peroxide or ozone. Okay. अल्कोहल हो गया. जब आपके सैंपल कलेक्शन होता है, ब्लड सैंपल तो सभी ने दिया होगा वंस इन लाइफ. हाउ डू दे क्लीन द एरिया? स्पिरिट. स्पिरिट में क्या होता है? अल्कोहल. और क्या होता है? इथाइल. So they are the different chemical methods. Now comes the safe injection practice. All of us at some point in our lives will have an injection to retain or restore our good health. But sometimes injections that are intended to promote health do the opposite. This happens when they are given in an unsafe way, using the same needle or syringe to give injections to more than one person. This is what I told you. Never reuse any needle. Never reuse any lens. Even don't recap the needle. अगर निडल आपने ओपन करा है कोई सिरिंज और आपको लगता है कि इसकी निडल बैंड हुई भी है, जस्ट डिस्कार्ड इट. डोंट थिंक इसको सीधा कर दूं, इसको रिकैप करके रख दूं, बाद में काम आ जाएगा. नेवर डू इट, बिकॉज व्हाट इट इज गोइंग टू डू, definitely it is going to give harm to some other person. It can be some patient or it can be one of our healthcare worker only. So never ever do it. A safe injection does not harm the patient, does not expose the provider to any risk, and does not result in any waste generation that is dangerous to our environment. That is one needle, one syringe, only one at a time. Prepare the injections using the aseptic technique in a clean area. Disinfect the rubber septum on a medication vial with alcohol before piercing. Do not use the needles or syringes for more than one patient. This includes manufacturers' pre-filled syringes and other devices such as insulin pens. Insulin pen देखा है किसी ने? Diabetic patients को देते हैं. Every time what we do is, pen तो same है, but we change the lancet ना. लगना तो उसी पेशेंट को है, सबका अपना इंडिविजुअल इंसुलिन पेन है, बट यू हैव टू चेंज द lancet every time. Medication containers are entered with a new needle and new syringe even when withdrawing additional doses for the same patient. आपने कभी हॉस्पिटल्स में या कहीं पर भी आई एम श्योर देखा होगा कि जब भी पेशेंट को हम कोई आईवी ट्रांसफ्यूजन देना होता है, हम मिक्स करते हैं मेडिसिन विद द नॉर्मल सलाइन एट द सॉल्ट ऑफ द मेडिसिन. तो इज इट लाइक कि हमने मिक्स किया, आधा भी चढ़ा दिया, आधा बाद में चढ़ा दिया? नेवर ना. वंस अ वायल इज ओपन, आप उसको पूरा फिल करते हैं इंजेक्शन को एंड यू ट्रांसफ्यूज इट टू द पेशेंट. बट इट्स नेवर लाइक दैट कि भाई आधा भी चढ़ा देते हैं, निडल को पैक करके रख देते हैं, सिरिंज में लोड करके रख देते हैं, बाद में चढ़ा देंगे. दिस इज आइडियली नेवर एक्सेप्टेबल एंड नेवर डू इट. व्हेन यू विल बी गोइंग टू योर वार्ड, इफ यू सी एनीवन डूइंग, देन आस्क दैट person not to do such things, because it is harmful for the patient also. Use single dose vials for parenteral medications when possible. Do not use single dose medication vials, ampoules and bags or bottles of intravenous solution for more than one patient. Amoxicillin देना था, लोड कर दिया आधा, पेशेंट को जरूरत नहीं है, पेशेंट ने लामा लेना. यू नो द मीनिंग ऑफ लामा? लामा इज लीव अगेंस्ट द मेडिकल एडवाइस. If a patient don't want to get continue in a same hospital and they say that they want to get a leave but medically not advisable, then the doctors give lama to the patient. They write on the discharge form that this patient is lama from the institute. Okay? तो उसमें अगर आपने medicines रख दिए कर दिया तो it's not like that कि दूसरे patient को लगा. Just throw the thing. What is immunization? Why is it important for everyone to get immunized? Like, as baby born हुआ, immunization status start हो जाता है उसका, immunization card बन जाता है. कौन से वैक्सीन लगते हैं सबसे पहले? Anyone? रेंडमली बताओ कौन कौन से वैक्सीन हम लोग को अब तक लग चुके होते हैं? पोलियो और हर रो से एक एक बता दो. बताओ. ओके, एनीवन फ्रॉम दिस रो? ओके. इम्यूनाइजेशन सबको पता है, सारे वैक्सीन लग जाते हैं. बट when you entered into healthcare practices, few vaccinations are mandatory. When you start working in healthcare sectors, few vaccinations are mandatory. They ask for your immunization schedule. They ask for your last vaccination. As per the Health Safety at Work Act, that is HSWA, in 1974, healthcare professionals who are directly involved with the hospital or other similar places of work should be protected from the possible infectious agents at play because they are more prone for the infection. Control of substances hazardous to health suggests a risk assessment of healthcare professionals to hazardous substances, including the pathogens, and take necessary measures to protect them. At the time of employment in any healthcare sector, what is required? To review the immunization status of the worker. Pre-exposure immunization schedule should be rechecked. Nowadays, when you go for a job, not only in the healthcare sector, in any sector, obviously, what happened in the last 2 years? Which vaccine came to be mandatory for everyone? COVID-19. Why it became mandatory? To reduce the transmission, है ना? वैसे ही जिस तरह से कोविड-19 मैंडेटरी हुआ, उसी तरह से हेल्थ केयर वर्कर्स के लिए कुछ वैक्सीन इंपॉर्टेंट होती हैं. Safety and efficacy of vaccines to be checked. Staff not at risk can be offered post-exposure prophylaxis. It is the duty of employers to conduct regular immunization programs of their staff under the management of occupational health services with qualified specialists. For all healthcare workers, the most important vaccination is HPSH, hepatitis B का vaccination. क्यों? Very common transmission through the patient, right? What are the benefits if you get vaccinated? It protects the individuals and their family members from occupationally acquired infections. Protect the patients and the service users, including vulnerable patients who may not respond well to their own immunization. Protect other healthcare workers and the laboratory staff. Allows efficient running of services without disruption. What happened when the COVID-19 was launched? सबसे पहले healthcare workers पे लगा. क्यों? Because they were the only one who were doing the job. They were the only one who were more susceptible. These are the vaccines which are very important for every healthcare worker to get it done. Flu, swine flu. Swine flu became mandatory for all those who are working in the respiratory units, all those who are working in the ICU. It became mandatory for everyone because again the healthcare workers were more prone to get exposed. So, at last, what is more important? Prevention is more important. Protect the patient, protect the healthcare personnel, promote your quality healthcare. Once you are infected, that means you are spreading the infection to all the people, all your colleagues who are working with you in the healthcare, and then you are carrying the same infection at your home. So, for you, important is to protect yourself first. Any doubt? कितने लोग आज हैंड वॉशिंग करेंगे ऐसे? जिन्होंने फोटो खींची है वो तो करेंगे, आई एम श्योर. मेक इट अ हैबिट, डू इट. एंड आई एम श्योर मोस्टली लोगों को नहीं पता था बिफोर कोविड-19 हाउ टू वॉश योर हैंड. किसी को नहीं पता था, हम नॉर्मली हाथ धोते थे. ठीक है, व्हेन कोविड-19 केम, everything become clear and the importance of everything. See, this is the starting of your MBBS. I'm sure all of you want to clear your MBBS with very good percentage, and everyone wants to get your desired PGC. Everyone is having some expectation, but the thing which will always help you is to keep asking the questions in every class. because this is a learning phase. आप अभी पूछोगे concepts हमेशा, although this is your 7-day foundation course, after that regular classes start होंगी. Keep studying, keep asking your faculties, because every subject is interconnected to each other. If you are good in anatomy, then obviously during final year you won't be facing any problem in orthopedics and surgery. Orthopedics is totally on the bones. It will help you. If you are good in pathology, I'm a pathologist. I did my MD in pathology. If you are good in pathology, you will be very good in medicine, because pathology gives you the reason of every disease, the cause of every disease. And medicine is treating a patient when you know the cause of the disease. When you don't know the cause of your fever, then what you are going to do? You will keep giving the antibiotics. But if you know the cause of the fever, then you will be treating the patient according to the cause. So if you are good in pathology, obviously you are good in medicine. So start learning as soon as your foundation course ends. Keep reading your books, keep learning all the time, because each and every class will be teaching you something good, which will make you different from other professions. Obviously, healthcare workers are different from others. जैसे जैसे MBBS खत्म होगा, you will realize no Diwali break, no Holi break, you have to work. Have you ever seen the doctors taking leave on the Diwali? No. Yes? You have seen doctors taking leave on Diwali? But they will be there, na? It's not like that कि emergency unit बंद हो गया या OT बंद हो गया. It's never like that. So, any doubt? So, how was the session first? Comfortable? Anything you learned today which was new for you? Hand washing? Okay.